Have you ever noticed if you're struggling to breathe through your nose or you have known sleep apnea that you tend to get more reflux problems, or at least some throat symptoms, which we'll discuss might be part of a reflux condition? Refluxing up into the throat, or laryngopharyngeal reflux, is actually triggered as a mechanical problem at night due to airflow obstruction. If your nose is congested or you have known sleep apnea, there's an increase in the amount of effort that it takes to move air into your lungs at night, especially while lying down when the nose tends to be more congested. During this phase of struggling to breathe, it's very easy to pull up stomach acid due to the negative pressure generated in your chest when you are pulling air in. From there, it's very easy for the acid to creep all the way up into the back of the throat and bathe the back of the larynx or the voice box with acid, which leaves a residual irritation the next day. That's felt as a globus sensation, or a feeling of a lump in the throat that won't quite clear, or a throat clearing or a light cough that persists for weeks or sometimes months at a time. There's also a thick layer of mucus that forms over that irritated lining on the back of the voice box, and a lot of people come in describing a clump of mucus or just a coating of mucus that is very difficult to clear from their throat at times. So this is the body's protective response. It's trying to shield itself from that stomach acid. In the ENT clinic, to better assess this condition, we use a flexible scope, which goes through the nose, past the palate, and looks down at the throat. And from that viewpoint, we can see redness and swelling and all of those characteristic signs of irritation on the back of the voice box. Sometimes we also see swelling of the vocal cords themselves, and that correlates with the change in voice that we sometimes see in this condition. Any stomach contents at all that make it to the throat are going to cause irritation. Solutions for a mechanical problem have to be mechanical in nature. The most successful treatment for this is actually sleeping at an incline. You can sleep in a recliner. If you have an adjustable bed, that makes it easy. You just raise the head of the bed to about 30 to 40 degrees. If you don't have an adjustable bed and don't want to sleep in a recliner, you can also purchase a wedge-shaped pillow. The key to using these successfully is that your entire upper body has to be at that incline. The pillow should begin at the hips and end behind the head for neck support in order to successfully rely on a wedge pillow at night for reflux. In addition to sleeping elevated, the next most important treatment is avoiding eating for 3 hours before you lie down at night. When you eat, not only are you increasing the pressure in your stomach, which contributes to the upward movement of stomach contents, but you're also increasing the acid levels in your stomach. For this reason, you need about a 3-hour window to finish digesting and clearing the stomach contents before you lie down at night. There are also individuals that know certain food groups or wines or specific things worsen their heartburn or reflux symptoms during the daytime. Those foods and drinks should be avoided as well anytime the throat is experiencing more symptoms from LPR. Finally, there are supplements such as alginate therapy, which has been used successfully in Europe for a long time. This is available in the US on Amazon in the form of Reflux Gourmet. It's a supplement that you can use at bedtime or even throughout the day to assist in keeping stomach contents down by forming a thick layer of viscous material on top of all of the thinner liquids within the stomach and reducing how much stomach contents make it through the lower esophageal valve. Finally, there are acid reducers that work quickly and can be taken as needed. The one primarily available over the counter is Pepcid, or generic name famotidine. This medication is very useful for a week or two at a time to help calm the throat symptoms when the symptoms are more severe, or if you're doing all of the behavioral mechanical solutions and those don't seem to be doing the trick. Finally, if none of this is working, you should really consider seeing a GI physician and having an upper endoscopy. So that sums up what laryngopharyngeal reflux is, how it's a mechanical problem, the underlying causes, and some treatment options to keep in mind, including sleeping at an incline, avoiding late meals, and using alginate therapy like Reflux Gourmet or Pepcid medication at bedtime in order to prevent the irritation from LPR. Stay tuned for more informative videos in the future, and thanks for watching.